What about supplements? Let's talk a little bit about those. What do you recommend for those? And is there medical support for those supplements?
Oh yes, omega-3 fatty acids, the fish oil, that's huge, anti-inflammatory. Curcumin, which is the component of turmeric, also antioxidant, anti-inflammatory. I like Flaxseed Oil, antioxidant, anti-inflammatory. Those are your supplements, the predominant ones for anti-inflammatory. I happen to love supplements, so I would tell you to take a good multivitamin, high in the doses of the B complex, all the B vitamins, iodine and selenium, because you really need optimal thyroid function for things like fatigue.
Can you talk about the clinical support for the omega-3, 6, and 9 profiles?
Well, you want to have a good ratio of omega-6 to 3. You want to obviously get more omega-3 than any others. You want that ratio to
Because
be...
it's anti-inflammatory.
That's right, because they blunt the inflammation cascade, the inflammatory cascade. You want less of your omega-6, and where you find a lot of omega-6 are in your processed seed oils, canola, sunflower, safflower. You really want to stay away from those oils. And you also want to stay away from fried food, because that's where we get into trans fats. Those are highly inflammatory.
You know, let's talk about the fried food factor, because my understanding is that once you start heating up these oils, it can really have a detrimental effect on
That's
that.
right.
Explain that to me, please.
It changes the molecular structure of the oil, and it makes the oil toxic and inflammatory, highly inflammatory.
Kind of a disincentive to eat it.
Yes.
Yeah.
Yes, so, you know, if you needed anybody to tell you to stay away from fried food and a good reason,
Right.
there it is.
You know, I found that when I started making changes to my diet, is I would ask myself this simple question: would I rather eat this, or would I rather walk?
It's true.
And I think people with MS who have vision problems can ask themselves that same question: would I rather eat this, or would I rather see?
It's that critical. And when you asked before, you know that sounds healthy for everybody, but why more so for MS? Well, that's your answer. That's your answer. It's that critical.
Yeah. And I think there's some, just as a patient, I can tell you, there's sometimes a little bit of resistance with physicians about recommending, other than just the obvious changes, you know, try to eat a more Mediterranean style diet. But when you get into the weeds about supplements and flaxseed and if you should eat red meat or not, it's problematic. But you say there's clinical support for those kinds of changes.
Absolutely. And again, to touch on supplements, vitamin D. Vitamin D is proven to contribute to a better clinical outcome with MS. What has been your experience with vitamin D?
Every MS patient has to pay attention to their vitamin D levels, and doctors don't routinely test for vitamin D. So the number one thing that a newly diagnosed patient should do is make sure that they're paying attention to their vitamin D levels. If your vitamin D levels are coming in at 20, that is not a good thing. You want to get your vitamin D levels up around 75. Your doctor can help translate that for you. But a higher vitamin D level correlates to a milder disease progression, and even reduces the amount of lesions that you're building. And I don't know if everybody is really on to the science of vitamin D, particularly those patients who are maybe seeing a general practitioner. A neurologist should know this, but they don't necessarily know it. I still meet people who are not paying attention to their vitamin D levels. It is the first and the easiest thing that you can do to impact your disease course.
Do you take an oral vitamin D supplement?
I do. I take 15,000 milligrams a day, and even taking 15,000 milligrams a day, I could not get my vitamin D levels up over 50, so I went online and I bought a bikini, and I put that bikini on, and I don't go out in public in a bikini. I go out in my backyard in a bikini, and I try to expose the maximum amount of skin, and I only do it in 15 and 20-minute increments. And in doing that, at least during the summer, I was able to get my vitamin D levels up to 69, and I got a standing ovation from my support group. So this is a long curve to get your vitamin D levels up. It's not like if you start taking 15,000, it's going to go up immediately. You need to pay attention. My non-doctor's advice, what I do is I get it monitored twice a year to see where it's going. And if I notice it's trending downward, I make sure I get more sun. Another good thing is if you're a swimmer, the time in the pool, in the sunshine, the rays that stimulate vitamin D production go through water.
That's great.
So you don't have to actually sit out in the sun. It can happen while you're swimming.
People need to remember that when they take their vitamin D, that vitamin D is a fat-soluble vitamin, and they should take it with a fatty meal. And by fatty meal, I mean if you're going to have a salad, put olive oil on your salad. Take it with some wild Alaskan salmon. If you're going to have some grass-fed butter or some grass-fed beef, because it is a fat-soluble vitamin, and for the best absorption, you want to take it with some fat.
And you know, another tip that I would like to pass on for nutrition is flaxseed oil. Flaxseed oil is super high in omega-3s, and I use it instead of butter. I squirt it into smoothies. You can't cook with it. It's a fragile oil. And I think the thing, people go, oh, flaxseed oil, that tastes terrible. If it tastes terrible, it's gone rancid. You need to keep it in your refrigerator. You need to buy it in a refrigerated case. And when it tastes bitter, it's out of here.
I like flax oil myself.
Yeah.
And flax seeds.